Welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I am the Public Health Division Manager for Itasca County. I am joined today by Jean MacDonell, President and CEO of Grand Itasca Clinic and Hospital, Monique Fox, Administrator, Essentia Deer River Hospital Clinics and Skilled Nursing Facility, Dr. Thomas Howard, Chief Medical Officer and Chief of Staff of Essentia Health in Deer River, Michael Sarafolean, President of Orion Corporation of Minnesota, and Marc Halpert, Chief Operating Officer of Monarch Healthcare Management, representing the Emeralds. We also will have Dr. Dan Soular with us, family medicine physician and Vice President of Medical Affairs from Grand Itasca Clinic and Hospital. We are joined today by our local and regional media. We will have our speakers present, and then at the end, we will have a question and answer session. We ask the media to please submit the questions via chat. We would like you to preface your questions with your name and the media organization that you represent, and then your question. Our panel will respond to the questions that pertain to their organization. Itasca County Public Health received laboratory confirmation of our third and fourth positive COVID-19 cases this past weekend. Both were affiliated with congregate care settings. At that time, we were able to connect with both of the facilities and our local hospital staff to coordinate additional testing needs, isolation and quarantine protocols, and PPE or personal protective equipment needs. As of this AM, we have received laboratory confirmation of 2 additional positive COVID-19 cases. No additional details on these cases are available to us at this time. We know that there are cases here in Itasca County, and as testing increases, the number of positive cases will also increase. Please continue to be diligent in your social distancing. This means not being in close contact with anyone outside of your immediate household. Continue to stay home per the governor's directive. Please wash your hands, sanitize frequently touched surfaces, and cover your cough or sneeze. We will get through this together in Itasca County, and it will take all of us together to prevent the spread of COVID-19. We are receiving questions about the Minnesota Department of Health website. The additional cases identified are not yet updated on their website map. We are in contact with the Minnesota Department of Health. They are aware of the new cases and will update their database when they have finalized the information that they are collecting. Itasca County has implemented a hotline to answer questions for the community about COVID-19. That phone number is 218-327-6784. At this time, I'd like to introduce Jean MacDonell from Grand Itasca Clinic and Hospital.
Jean, we can't hear you. You got to unmute your mic or your.
Can you hear me?
No, we can.
Yes, thank you, Jean.
Yes, okay, sure. Sorry about that. I'm Jean MacDonell from Grand Itasca. I'm the president and CEO. And as Kelly said, we have been speculating that there are a higher number of COVID positive cases in our county. And now that Grand Itasca, along with the other facilities, have been able to increase testing and lighten the restrictions, we're going to see more cases coming through. At Grand Itasca, we've started to test outpatients who have symptoms and underlying medical conditions, and that will include patients over 65, anyone with a chronic condition or an underlying medical issue. We're, of course, testing healthcare workers, emergency personnel. We have curbside testing available 8 to 5, 7 days a week. So the process for calling is the same. So you can call our main number and have a telephone visit and then go through our curbside process to get tested. And we're available there at the curbside as well as via video and telephone. I just want to thank Kelly from Public Health and the facilities, and again, echo the collaboration has been great with all of our county personnel and our neighboring facilities. So thank you.
Thanks, Jean. And Monique from Essentia Health.
Hi, Kelly. Thank you. Monique Fox, the administrator here at Essentia Deer River. I will just briefly just share with you, and then Dr. Howard will also share some information with you as well. What I would just like to share is, in light of the congregate living findings, what we have done is really work to define the flow of patients, both as they are admitted and as they are discharged. And just today, we shared with Joe Thompson from the Northeast Regional Committee what our flow diagram looks like, so that we can reinforce with the congregate living facilities and other testing sites what we are doing to show due diligence as we bring those patients in for care, as well as when we get ready to discharge them, so you can be assured of that process. Hopefully it will help identify where the appropriate placement of that patient goes when we return that patient into the community. Or if you were unable to do so, we will collaborate with you and the state number to get the right placement for that patient. So Dr. Howard, I will let you share your comments as well.
Yeah, this is Dr. Thomas Howard. I'm the Chief Medical Officer in Deer River. And this last weekend, our EMS staff brought something to our attention that they had noticed patients, they were delaying seeking medical care. So the American Heart Association, the American College of Academy of Neurology, and the American College of Emergency Physicians released a statement on April 22nd, highlighting the fact that they've noted nationally a marked decrease incidence in heart attacks, cardiac arrests, and strokes. And they opined on that they did not believe that was since the onset of COVID-19. Their opinion was that there's nothing about COVID-19 that would decrease the incidence of heart attacks, strokes. But their fear was that patients were delaying seeking medical care because of fear of acquiring COVID-19 while seeking that care. So their opinion and our opinion here is that it is safe for everyone to call 911 if they have concerns. It is safe for anyone to seek medical care at the hospital. The hospitals in your county and regionally have taken tremendous steps to make the care safe for the patient and the provision of care safe for the staff. We sanitize, we socially distance, we make our rooms safe for care. And additionally to that, the best way to prevent having an urgent or emergent condition is to continue to get ongoing chronic care for your chronic diseases. So please do not fear going to see your physician either in person or through a virtual video visit to make sure your blood pressure is under control, your diabetes is under control, all these things that impact your chronic health.
Thank you, Dr. Howard. And now we will turn it over to Michael Sarafolean from the Orion Corporation.
Yes, good morning or good afternoon. As I believe you are aware from the statement that was released, Orion Corporation provides residential supports to people with intellectual disabilities, and we have 8 small residential settings in Itasca County, as well as providing supports in individual and family homes. On Thursday evening, April 23rd, one of our employees notified us that she had been in close physical contact with a family member who had received notification that that family member had tested positive for COVID-19. We immediately removed her from the schedule and directed her to seek medical evaluation. She received confirmation after testing on Friday. She received confirmation on Saturday evening that her results were also positive. Since then, we have worked closely with Itasca County Public Health and Emergency Management, Grand Itasca Clinic and Hospital, and have been in consultation with the Minnesota Department of Health. we were able to secure quick testing of the folks who lived in the setting, as well as other employees who may have had contact with the employee. And as of today, as of this morning, 8 of the 9 tests that we were able to have completed have resulted with negative results. And we were awaiting the last report. In the interim, we continue to provide support to the three individuals living at the home and expecting compliance with MDH and CDC recommendations for our small group residential settings, such as screening residents' employees for symptoms, wearing of masks, frequent hand washing and sanitation, restricting visitors, and practicing physical distance. My last piece I wanted to say is how grateful we were for what we thought was extremely timely, effective, and efficient response from all of the folks in Itasca County in providing us with the assistance in order to respond to this incident. Thank you.
Thank you, Michael. And we have Marc Halpert from Monarch to speak on behalf of Emeralds. Welcome, Marc.
Thank you. How you guys doing? So yeah, my name is Marc Halpert. I am the Chief Operating Officer at Monarch Healthcare Management, who operates the Emeralds of Grand Rapids. And we were informed on Sunday morning that we had an employee who came into contact with a family member who tested positive for COVID-19. And that employee was having no symptoms. Actually, about 3 weeks before that, actually was having symptoms. We sent home, did not have any interaction with the residents, stayed at home for 2 weeks for the quarantine. And when she came back, was done. We did the daily screening every day, no symptoms, no fever. So came back to work. Once we heard that she had interactions with her family that tested positive, we did remove her again from the schedule and from the facility. She came in contact with approximately 19 residents, providing care for them. And 18 of them have now tested negative for COVID that we did run through tests, with 1 coming as positive. We are still working on some other residents in the facility. However, at this time, no residents are having symptoms of any of the variety of symptoms out there. So that's really great. And we're keeping an eye on things. The biggest part of this is, as we were kind of chatting the last couple of days, as we go out there, and come to our facilities or go to the supermarkets or wherever it is, our focus and our community message to everybody is really, please make sure to wear those masks. Please make sure to social distance. Please stop seeing people outside of your house that are not your family members, that are not living with you. Don't even go to see your mom. My mom lives in New Jersey. I haven't seen her in about 9 months, and she's getting quite frustrated with me, but the goal is to keep her healthy and keep her safe. Really, the more that we do, the more vigilant that we are to protect ourselves, we are protecting others. Our job at Monarch Healthcare and the Emeralds of Grand Rapids is to provide the care for all of your loved ones, to ensure their safety. We are going to work every day. Please stay home for us. I know the signs are out there. I know we keep repeating it. That is the biggest message we can share. I know the hospital is probably saying the same thing, fighting the good fight. It's difficult. We're smiling. We are staying positive. We have daily messages to our staff. I just produced a 1 minute and 11-second video for all of our sites, including the Emeralds of Grand Rapids. Just a feel-good video showing pictures of our staff, our residents. It'll be on Facebook. Check it out. We're really working 24 hours a day, 7 days a week to keep our residents and our staff safe. And we just thank you guys so much for the patience that you've given us over the last several weeks. For the family members that are on the call right now, not visiting when we asked to restrict the visitations, and on behalf of our residents, we thank you, and we thank the the Itasca community and the entire board. Thank you so much for your support during this very trying time.
Thank you, Marc. With that, we will move on to questions, and we do have a few in the chat box already. Thank you so much to the media for adding your name and the organization you work for and the question that you have. First one is from Beth at ICTV. What is the county's capacity for contact tracing, as that is a big part of keeping people safe? There is information that additional tracers may need to be hired. Is that the case here? Great question, Beth. I will take that one on. So the Minnesota Department of Health, their role is both the case investigation as well as the contact investigation, and they have criteria and training for how that is conducted. There have been discussions between the Minnesota Department of Health Infectious Disease Group as well as local public health agencies throughout the entire state of Minnesota. As of this time, Minnesota Department of Health is maintaining that role and are planning on increasing their capacity. However, there has been some conversation about whether locals have the capacity to do that. I can say that not every county is in the same position to do that. Should the Minnesota Department of Health ask us to be a part in that, we would likely conduct some of those ourselves, but it is their decision at this point, and so we are awaiting their direction. Thank you. Jennifer from ICTV to Orion Corps. Congregate care is only being reported by MDH for homes with 10 or more residents. Since Orion Corporation has many facilities within the state with less than half that number, I'd like to know if this is the first home that has had an employee or resident test positive for COVID-19.
Yes, that is the case.
Thank you, Michael. Heidi from KXC. Numbers are still small in Itasca County. Do you expect an uptick this summer with increased populations and lifting of some state stay-at-home standards? Kelly mentioned diligence with social distancing. Many with better weather seem to think it doesn't apply to them, especially with small numbers. What message would you like the media to make regarding this? Is that something one of the medical providers would like to speak to, or would you like me to?
Yeah, Kelly, I can jump in on this one. Dan Soular, Vice President Medical Affairs from County Itasca. My personal opinion is I think this is the tip of the iceberg with the warm weather, cabins opening up, fishing seasons coming up. I do believe that a lot of, the increased travel will see our cases increase. Certainly, as all of our facilities in the area are also increasing our testing capabilities, that alone will also cause an increase in numbers as well. And so, we of course continue to recommend if you are coming from the metro or outstate to try to quarantine yourself as best as possible for 14 days so that you can be assured that you don't have any symptoms before you start interacting more widely. But again, recognizing that social distancing recommendations that the CDC and the MDH is continuing to push.
Dr. Howard, did you want to add anything to that?
Well, only that I've heard several people say that I don't know anybody with COVID. And that to me does not mean that COVID's not out there just because you don't know somebody with COVID.
Thank you. Are there other questions from the media?
Is Kathy Lynn trying to ask a question? She's muted.
She's shaking her head. No, she wasn't trying to ask a question. Thanks, Kathy. Okay, from Renee at WDIO. To clarify, one new case involving an Orion employee and one new case of a Monarch resident. Michael and Marc, do you want to clarify your positive cases?
Sure. I mean, this is for the Emeralds of Grand Rapids. We did have one employee that tested positive on Sunday morning. We did have one resident come back positive today with 18 negative cases. So we're still staying positive that we're hopefully stopping the spread of this and on top of it. So yes, that is correct to confirm what you had said.
Michael from Orion.
Yes, we have had, as I stated, we have had one employee who tested positive, and we were made aware of that on Saturday. Since then, any of the testing that has been performed has resulted in negative results.
Thank you. Heidi from KXC. If someone is sent to Duluth or Minneapolis, are the COVID numbers counted in St. Louis County or Hennepin, not Itasca? Do one of the providers want to take that on? Otherwise, I can answer that as well. Perhaps Jean? We're not hearing you come through, Jean. I'm not sure why that is because it did look like you were.
Can you hear me now?
Thank you.
All right. This is Jean from Grand Itasca. If the patient is a resident of Itasca County, then they will, and they're tested here, they will be counted in Itasca County in our numbers. So if we test a patient here and ship them to Duluth, and we get the test results after they're transferred, the numbers still count for Itasca County.
Yeah, and I will add to that, it's the zip code where they live, it's the county of residence. So even if one of our persons from Itasca County were tested in another county, it would end up counting for us. Other questions? Kathy, KOZY, as the summer gets closer, what are your recommendations for people visiting their cabin? The stay-at-home order is going to get harder and harder. I believe Dr. Soular and Dr. Howard had indicated this. Do you want to speak to this again for our persons visiting their cabins?
I just think that when you're visiting your cabins, wash things down, wear a mask if you're, interacting with other people, just continue social distancing, do appropriate quarantining. As my guess as well is as things are lifted, people will gradually, they'll continue on their practices for a while. And I think that's good. I hope that they do continue with good social distancing practices in general.
Yeah, I would just echo what Dr. Howard had to say. We know some of the cases that we've had up here have been from direct contact of travelers coming from the metro, and that's been our fear all along. And so just continue to follow that social distancing, cleaning, hand washing, whatnot. Even though it's summertime, we still need to follow the recommendations as directed by the governing bodies.
Thank you. Greg Grau from WDSE. To hospital officials, do you have enough testing capacity now that the university and Mayo are ramping up production?
This is Jean again. Can you hear me, Kelly? Sorry, my audio is weird. We do. We have enough testing capacity here at the moment. We are a little nervous with the lightening of the restrictions, depending how many tests we go through. How we'll keep those supplies rolling in. We have a back order of swabs on order on a regular basis. And we, of course, will utilize the university in Fairview for supplies if we need to. But we're okay for supplies at the minute.
Monique, thanks.
This is Monique from Essentia Deer River. Yes, we are also watching our supplies, but we feel like we are well established right now with our rapid testing. And as long as we follow protocol and continue to watch those tests and availability as the testing expands, we're in good shape, especially with support from the system for our swabbing and testing capacities.
Thank you. We have enough time for about one more question if anybody has one. Great. I'm seeing no questions. I thank you so much for joining us today, both for our speakers, our hospital and facility staff, and for our local and regional media. We appreciate your support as we're stopping the spread of COVID-19. Thank you so much, everyone, and have a great rest of your day.